All right. Look at that, Dr. Kris. And we did it again. We're streaming on Facebook, YouTube, all the places that the cool kids do. How are you, Dr. Kris?
I'm good. Having a good day. How about yourself?
I'm doing well. So today we're going to talk about the things that all the guys want to talk about, problems in the bedroom that no man ever admits to, right? Unless they're talking to Dr. Kris. So here we go. I'm going to roll the intro. We'll take off. If you're like most folks Dr. Kris Fusterhausen works with, you're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the Dr. Kris Life Podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris Podcast. All right, showtime. How are you doing, Dr. Kris?
Good. You know what? It's finally quit raining. Thank God. It's been raining so dang much. I know it's weird as a Texan, right, to say in June, thank God it quit raining, but there's only so much it can only go so many places. And so, it's been flooding around here in some spots. So we're kind of happy it's going to look like a normal, hot, dry day in June.
Cool. When you started the research clinic, you started it for age management and improving your health. Did you, how much of your business did you expect would be around the topic of men having issues in the bedroom?
So whenever I started this business, I was in my early 30s and now I'm in my, early to mid 50s. And so I probably didn't really understand the frequency of how many guys are affected by issues in the bedroom. I think, as I always say, many times as a doctor, things hit when things hit personally home is when you start to realize how big of a deal it is. And so I'm sure I underestimated it. Just again, I know we say these stats a lot, but 40% of 40-year-olds, 50% of 50-year-olds, 60% of 6-year-olds have some form of sexual dysfunction in men. And it's not a male-only issue, by the way. I know we're going to be talking about guys today, but sexual dysfunction is not a male-only issue. It can have just as big a psychological impact on women as men, but, women can still have sex. Guys, if erectile dysfunction is bad enough, they can't have successful penetration and ejaculation, if we're being scientific. So, it can really change their lives because, as I always say, intimacy is something that hopefully none of my patients, I know I don't, that is something you want to lose as you age. Intimacy is extremely important for many, many reasons. I think it's one of the things that keeps marriages and relationships strong. And so obviously it has become a big issue in our clinic because we try to ask about it. We try to talk about it. We try to talk about our own experiences and, put guys in a situation where they feel comfortable because, still you can ask and you can, still there's guys that you'll say, how's your sex life? Oh, it's great. And then the wife comes in later, like, did he talk to you about his issues? Like, nope, he said everything's great. And it's like, sometimes it takes a little while to tease that out from some of the guys.
I remember a long time ago, I was having lunch and this older guy that I knew, he had prostate surgery. And that totally turned it off. That just ruined all this. Yeah. And so, but I remember him just talking about it at that lunch and how he just kind of given up on that was like a hard thing for him to take.
Yeah. Pardon the pun, right? Um, sorry, we got to throw some humor in when we talk to the guys. Yeah, I mean, it really is. Like that would be the good news is those type of surgeries have come a long ways these days.
Mm-hmm.
It is actually like I'll see some guys sometimes like, well, if I have prostate cancer, I'm not going to do anything because I'm not risking losing my erection. I'm like, man, that's so low frequency these days that those surgeries have come a long ways. The rate of impotence is very, very low after prostate cancer type surgery. So that's the good news. But yeah, again, kind of like we talked about last week, there's certain patients that believe losing your erections is just having issues in the bedroom, as we're saying today, is just something that naturally happens and we just have to accept it. And I think that's bullshit. Like, we shouldn't have to accept certain things just because something is deemed as a normal act of aging. First of all, is aging normal? I don't think so. I think that many people are aging at a much more rapid rate than they did decades ago. And there's a lot of reasons behind that. And, we know aging is a disease and we know that there's different rates of aging. Everybody talks about the hope of stopping aging. Well, I don't personally think that's realistic, stopping aging, but we certainly can slow down aging. And many times erectile dysfunction can be a sign of aging, a sign of inflammation, a sign of other things going on in the body. So even if maybe you don't think, first of all, I haven't met a guy who thinks losing his erections isn't a big deal. Okay. But let's just pretend for a moment you're like, not a big deal. But it can be just a sign of such bigger things. Like you and I've talked about cardiovascular disease, the most common way every person on this earth dies is cardiovascular disease, and erectile dysfunction, however early on, can be a sign of cardiovascular disease. As we've talked about on this podcast many times, your body just doesn't pick out your penis to start blocking blood flow to, right? It's going to be happening all over the body. It's just that's a tangible part of our body that we can tell that something has changed, because what's an erection? Erection is blood flow to the tip of the penis. So if that erection is not acting right, that can be a sign of bigger problems. Although there's a lot of guys will say that is the biggest problem, and which I respect. Again, another bad pun. But we want to look at that and make sure we're looking at the patient as a whole, versus just always giving things to fix the ED. But that is an important topic I'm sure we'll get into, about things that we can do for, like, let's just say your heart is healthy. This is purely an ED problem. There's a lot of things we can do about it.
Yeah. And then there's the emotional side. Things can be going on in the relationship. There's alcohol consumption. There's a lot of things. Is it hard to pinpoint where the main offender is coming from?
Yeah, it can be. Psychologic plays a big role in our erections, right? Like not to get too personal, I think every guy's had that experience in life where they had, maybe you were younger, maybe you're inexperienced, maybe whatever, and maybe you had a bad go, okay? And then that gets in the back. I can't tell how many times I've had a 20-something-year-old come in and say, I've got ED. And I'm like, what do you mean you have ED? Like, well, sometimes I have erections, sometimes I don't. And I always say a lot of times that's psychological. That's a little bit of stage fright. They had a bad experience. They're so concerned it's going to happen again. And you got to kind of coach those guys through that. And that even happens to our age range. There's kind of this fear, like, oh my God, is it going to happen to me? Because, without getting too dramatic, I think it sometimes makes us guys not feel like a guy. It's like, God dang, I'm losing my manliness. I can't even keep an erection. Like, I was talking to a patient the other day, and he's like, sometimes it just goes away during sex. And I'm like, yeah, that can be very, very normal. So one of the things I first recommend to every man who's having any form of erectile issues is to communicate with his partner. I feel like that's uber important. First of all, if your partner's not into, like, either they make you feel like, that you're not a man because you're having issues, or they somehow belittle you, they're probably not the right person for you. But I think it's really important that the partner understand you're having some legitimate issues that is not related to them, because it's quite common if a guy can't keep his erections, that sometimes, the partner will think that they're the problem, right? Like they're doing something wrong, when most of the time that's not the case. So I think that, especially if I think there's an emotional side of it, I think that that's a big part of it. Plus, if they're going to be trying some different things to help with their erections, I think it's very important that their partner understand, like, hey, we're trying this, seeing how it goes. And then if it doesn't go well, okay, we're not going to make a big deal out of it. We're going to try again or try something else. So I just think open communication is extremely important. I think you'd be surprised at how many couples I talk to separately that don't talk about their sex life. And I think that's a really, really big problem. And so that's one of my biggest things I ask whenever a guy says he's having issues, like, have you discussed? Most time these are guys who are married, and I'm like, have you talked to your wife about it? Does she know that what's going on? I mean, obviously she knows, but is it something y'all have discussed? And if they haven't, I encourage them to go home and discuss it to start off with.
So, what are some of the things? Obviously, the default thing we've all been advertised to is we got to go to a drug, some sort, be it Viagra, Cialis, whatever. But what are some things that guys can start to
well, let's talk about those drugs. First of all, those are PDE5 inhibitors, and the most common is Viagra and Cialis, right? Sildenafil and tadalafil. I'm a huge fan of tadalafil. Tadalafil does so much more than just give us better erections. It's actually really good for our vascular system. So we actually have healthier cardiovascular systems when we're on a tadalafil. It also has a really, really positive effect on our prostate size, and urination patterns. So that's a really positive. I most guys, I'm 53, we're about the same age, will agree. Like, I used to always joke, I'd pee by my son, and when he was little and he could like arc it, and now you're just trying to hit the toilet, right? And so it's like, let me aim up. So just the fact that it'll improve your urination, improve your vascular system, I really think tadalafil is one of those medications that every guy should consider taking no matter what. The good news is even if you said, Doc, my erections are 10 out of 10, that's great, but there's still reasons to take tadalafil. And now that the fact that it's really inexpensive, and let me blow the lid off of something here, like to any guy maybe listening still paying for like Hims or something like that, these drugs now, 90 days, I can send you a script down the pharmacies, $23 for 90 days. Hims and Hers and all these companies really got popular back when these prescriptions were hundreds of dollars a month, and they were able to give you something that was, $75 a month, and it was a really great deal. Now those products are actually more expensive. They're not a great deal anymore, but a lot of people just don't understand how inexpensive they've gotten. If I said, hey, Steve, there's a pill you could take every day that's actually really good for your heart. It's really good for your urinary system. And oh, by the way, better erections. And it's going to cost you about $7 a month, less than, heck, what is that? A cup of coffee today at Starbucks, maybe. You probably go, well, that's a pretty damn good thing. Yeah, let's do it. So tadalafil, PDE5 inhibitors are great. The problem that you have to remember is PDE5 inhibitors are dilating blood vessels. They're creating increased blood flow to the penis. But that is a Band-Aid fix if there is a real circulatory problem. It's not reversing anything as far as that goes. So if you just think I'm going to take Cialis for the rest of my life and everything will be fine, you may. You may live to be 80. Cialis worked the whole time. You die from a heart attack or whatever, and you were able to have sex till the day you died. But there is a chance, like especially when guys want dose increases, like, hey, that dose you were giving me is not working anymore. That's like a telltale sign, like, like what's going on here? And we'll see that occasionally. And, like eventually you get to max dose and it's like, well, Steve, I've got you maxed out. Like, well, that's obviously not working. So PDE5 inhibitors, I think, are very important, specifically tadalafil. Inexpensive, low side effect profile, do a lot of other great things for our body in addition to giving us better erections. Actually, I off-label love to use it in women. It works really well for the same reasons that we just talked about. A clitoris is nothing more than a small penis. Okay. So women's, a clitoral orgasm is very similar to a male orgasm. It requires blood flow. So guess what? Women have the same issue guys have as they get older. That's why women have sexual dysfunction too. They're like, just good God Almighty, sex doesn't feel quite the same, or God, having an orgasm takes 3 years. So I just give up. And, once my husband or boyfriend or whoever finishes, I just move on with my day. They can respond to tadalafil very well as well. So we need to realize that tadalafil is not just a male-only drug. It's not just used for pulmonary hypertension and erectile dysfunction. It can be used off-label for other uses. So that's the PDE5 inhibitors. But one of the things that we really like in our office is using shockwave. Again, as we've talked on here before, shockwave, acoustic wave, pulse wave, those are all same thing. Okay. Those 3 words are all 3 phrases saying the same exact thing. We're using little waves to go through the tissue to break up microcalcifications or blood flow restrictions and cause what we call neovascularization, which is a microscopic traumatic injury that causes new blood vessels to form. So as I always say, like if I'm trying to get water to the other side of the room, I'm trying to clean out the pipes that are already there, the blood flow, that's the microcalcifications. And I'm also trying to put down new blood vessels, new piping to get the blood to where I'm trying to go in this case. So the one that we really like, we like using now. So we used to do it in office. We still can. That's not the popular way we like to do it nowadays. Trying to talk a guy into coming in a couple times a week and having his wiener shocked is not always the easiest thing for guys to do. It's done typically by my female employees. Can be a little embarrassing. Works pretty well. Works very well, actually. So let's pretend a PDE5 inhibitor does not work for you. Cialis, a Viagra. You have a 66% chance of shockwave therapy of working. The studies are clear. Like 66% of PDE5 inhibitor non-responders actually respond to shockwave therapy. And the advantage of shockwave therapy is we're actually reversing the ED. So instead of just band-aiding it, we're reversing it. Can you use PDE5 inhibitors with shockwave therapy? Of course. So, but now we have a handheld home device called the Phoenix. So we're big fans of the Phoenix because guys can use this at their discretion at home. It's actually a much more cost-effective way to go about doing this. Like I said, it's discreet at home. The device is simple to use. It actually has a time relay in it, so you can't use it too much. It literally won't turn on until it's been long enough to use it again. So it's a great device. Studies are showing that it's nearly as effective as in office, procedures with the big fancy $50,000 machine. You're getting about 80% of the same results at home, but you can do it at home and you can do it basically forever. That's the good news is, this is something that I just talked to a guy today that's been using it for well over a year and he's doing well with it. So we really like the Phoenix because of what we talked about. It's discreet. You can do it on your own, do it on your own time, has results, works nearly as well as what we were doing in the office. And it's a much better price point for the patients, much more affordable option for those patients.
So what are, you've got those treatments down, but obviously maybe a lifestyle change needs to be considered. What are some of the things that make a big difference?
Well, you got to remember that anything like this is typically, it starts with inflammation. So anything that can lower inflammation in the body is going to ultimately have a positive impact. So it's all of those positive things that we talk about, trying to stay away. You already said it. One of the big ones is tobacco. Is alcohol, but the other one is tobacco. Okay. Yeah. So trying to stay away, trying to live a clean lifestyle. These are just good health tips, right? It's funny though, sometimes guys won't clean up their life until ED comes around the corner. And then they're like, oh God, now I'll listen to you because, I can't get it up in the bedroom. And, obviously that's a big blow. As I tell everybody, I've had 2 phases of ED issues for me personally in my life. one was in my mid 30s, and looking back, it was more of a lack of get up and go than it was the ability to have sex. But I just noticed that my erections weren't what they were used to be. That's when I found hormones and replaced my hormones. Now, it's very important to understand testosterone does not fix blood flow restrictions. And I tell this to every guy that comes in. If you've got a true blood flow restriction, testosterone will not positively affect that. If it's more lack of get up and go, like, dude, I'd rather just watch, Murder, She Wrote versus actually have sex. Well, that's really old. I don't know where I came up with Murder, She Wrote. I don't even know if you can still watch that. But, when you would rather do that than have sex, that's a lot of times just lack of get up and go. We can bring that back with hormones. But actual like organic ED, testosterone will not fix. But typically we're going to say exercise, proper sleep, one of the things. So anyway, that fixed it for me, right? So mid 30s, now sex is back to good again. Everything's great. Then about mid 40s came. And then I was like, hang on a second. I know my testosterone's good. My body composition's good. I don't drink that much. I don't use tobacco. Why am I starting to have erectile dysfunction again? And that was, for me, true organic erectile dysfunction. It was starting. And that's where I use shockwave therapy. Used it off and on for a year in office and haven't had any issues since. It's been about 8 years. I do take tadalafil every day for the reasons that we just discussed. I can get an erection, have sex, be just fine without tadalafil. But I'm not going to tell you it doesn't make sex better. But the other reasons I'm taking it is for the other anti-aging characteristics that medicine has. So as I was telling my guy, though, that was on his, so just clean lifestyle, right? All the stuff. Stay away from processed foods, bags and boxes. Let's eat whole foods. Let's eat clean. Let's drink enough water. Let's sleep well. Let's cut out alcohol. Let's cut out tobacco. And let's see where we're at. You're going to do better, look better. Your skin's going to look better, and hopefully you're going to have better sex because you feel like it and your inflammation is decreasing in your body. And that's a simplistic way to look at it, but that's where you start. There are other things, though, that we add to it in addition to PD5 inhibitors and the Phoenix. There's a great peptide. Let's make sure we cover our peptide called PT141. It was found many years ago as a side chain of melanotan. Melanotan is a peptide that does lots of cool stuff, like including tanning you that we've talked about before. And they found that these patients that were on melanotan had increased libido, increased sexual function in guys. They figured out the side chain, cleaved it off. That's PT141. PT141, going back to those guys that don't respond to PD5 inhibitors, you can, a lot of times, about 2/3 to 75% of the time, they'll do really well with PT141. The negative of PT141 is you can only use it a couple times a week. So that's kind of a negative. It can desensitize to it if you take it too much. And also is really slow acting. So you take a shot of it, not in the penis, by the way, just in the belly. And it will take about 4 to 6 hours to start working. So a lot of times that's a problem. You got to kind of anticipate having sex. Like I remember one time a patient said, I take it at 8 o'clock and at 2 a.m, I wake up with an erection. He's like, what do I do? And I'm like, either have sex at 2 a.m. or take it at 4 o'clock in the afternoon. Like, let's move it up in the day. Like he was trying to have sex at 10, by the way. So common sense stuff. But PT141 can be a really good thing. And then we're really big fans of like a PRP injection into the penis. That's where you actually draw blood, spin it out. It's called plasma-rich platelets. It's all the good stuff in your blood that we then re-inject into the penis. I know every guy that as soon as I say inject into the penis, they get squirmy in their seat. As soon as I say that, sphincter tone like goes up about 4 notches. I can honestly say I've had a pee shot. It's not that bad. It's a very quick procedure. We've been doing it for years. I'm not going to tell you it's something that you're going to look forward to, but it's not something that is horribly painful. Scale of 1 to 10, it's about a 4. But the great thing about PRP is there's no real downside except that maybe it doesn't work. But I can't think of a time where a guy said it did nothing. It's your own blood products being re-injected into your body. You can inject it into your scalp for hair growth. You can inject it into joints for joint health. You can dermaplane it into your face for, facials, the vampire facelift. If you pay for those names, we don't, but those are trademark names, but it's used for lots of different cool stuff. PRP is harmless. inject it into the penis, clitoris, G-spot. Women do it too. And you can get an effect for about 12 to 18 months after that. So it's a really nice, easy thing to do to try to help. And a lot of guys, they kind of put it all together, right? Hormones, tadalafil, because of the reason we talked about. Oh, yeah, by the way, I've got my Phoenix. Oh, yeah, by the way, every 12 to 18 months, I get a PRP shot into my penis because I want ultimate function. Have a few guys that come quite frequently for PRP shots, more frequently than I think they even need to. And I'm like, why? And they're like, I just want to make sure I keep everything working perfectly. I don't want to even risk it. So, that's kind of the gamut. And then by the way, there is one called like Trimix, which is where you actually inject it into the base of the penis. You got to usually be under a urologist care for that. I'm not a fan of that way. First of all, that doesn't sound all that. Hang on, honey. Let me go inject my penis real quick. It can cause scarring of the penis. Really, that's like nothing else works type of thing. And then last but not least is the way that no guy wants to do it. And that's a penile implant, where they basically just put a pump up into your penis. I've yet to meet a guy that's had that thinks that's a great thing. Most of the time they get no real sensation from it because there's not any actual blood flow. It's just pumping the penis up more for the female. It's kind of a sex toy at that point versus an actual like penis at that point. So anyway, and then, last but not least is, going very much back to where we started with this conversation is communication. And I think some couples, erectile dysfunction starts to kick in, and then kind of complacency when the sex life starts to kick in. And I heard this doctor do a very good job last year at Sunsea in Mexico, talk about, not that we're sex counselors, but keep the spice in your life somehow, some way, however that is for a couple. I always tell them what's spicy for you may not be for me, or may be so crazy for me I would never even dream of that. But communication, like, sometimes people are together for long periods of time, and it's just important that you figure out how to keep the sexuality going in your relationship. And that's different for everybody. I get asked a lot, like, what's a normal frequency? And what I always say to that, whatever you determine it to be. I mean, having sex once a month may be what you deem. And if both people are completely and utterly happy with once a month, there's nothing wrong with that. Some people think 3 times a day is normal. I'm like, good God Almighty, how do you get anything done? But that works for them. That works for them. So that's why I always say, I don't think there really is any normal frequency. It's just different for every couple.
Yeah. So I'm curious about, in your practice, you have a lot of folks that come to your practice and for many reasons, but what percentage of your practice addresses this issue?
I think it's probably more than we really realize it, because we talk about it so much that, sometimes we're not even paying attention or tracking it. I would probably say it's at least 20-25% of the practice is somewhat related back to sexual dysfunction. But I would say the whole practice is geared towards it, though. I think sometimes just preventing is what we're trying to do, because I have no doubt that if we can keep ourselves from not being inflamed, and by the way, what's one of the big ways we've talked about it all the time? What's one of the big ways to keep us from getting inflamed? Keep our visceral fat under control. Don't get the pot belly. Okay. That pot belly hurts you in so many ways. Sometimes that's how I'll tell guys, like, I can tell a guy that your pot belly is going to your pot belly is raising your risk of cancer. That doesn't hit home. When I say your pot belly is going to maybe take your erections away, then they're like, well, hold up, doc. Like, and so, by the way, there was a study that came out the other day that showed that guys on GLP-1s get a longer penis. I was like, by God, if we needed another reason for guys to take GLP-1s, getting a more length, right? And I think that's probably just related to losing fat pad reduction. But anyway, I just thought that was funny that somebody's actually tracking that, right? Like, of all the things we're tracking, but okay, cool. Whatever it takes. But yeah, I mean, just I would say 20-25%, but I would say the whole practice, that's one of the main things, is because I just really, really believe that intimacy is so important for, I'm always bummed whenever I see people that get divorced. I somewhat sometimes take that a little bit personal, because I wonder, like, could I have done something more? And one of the biggest positives are one of the biggest things that I feel joy out of is when I see marriages actually let's just say relationships strengthen because of their sex life improving. And I tell everybody, and I don't mind saying this, my marriage is definitely better when the sex life is better. When the sex life is poor, it leads to more fighting and just that sort of thing. And I just believe intimacy is so important for strong relationships, marriages, that sort of thing. And we don't have to lose it just because we're aging. That's a ridiculous concept. And I think that you hear people all the time, like especially ladies, will be like, yeah, I don't care anymore about that. They're bullshitting you deluxe. If they really don't care, then I feel really sad for that person. They're either at the stage of their life where their quality is crap or they don't like the person they're with. By the way, what's the one thing I cannot fix is if they don't love or even like their partner. And I get that sometimes. Like they're like, I got a divorce and now I'm with Becky and all of a sudden my sexual dysfunction went away. And it's like, imagine that. Like you were just unhappy, and that does play a role in it. So, we can't, it's libido. People come in complaining of libido. And I seriously, one of my first questions I ask is, do you still care about your partner? If they were like, I can't stand the sight of her or him, well, that I can't fight through it. Like, at the end of the day. So.
Do these last question? So do these conversations around sexual function, are they generally started later after you're already addressing other things, or do some people just start out of the gate with it?
Well, so we have specific questionnaires that every time any new patient that comes in our office has the opportunity to say, here they are. And what we find is most people are okay with being honest on a questionnaire. That feels very benign, right? Like, let me just check. And they might not, like, let's say it's mild, moderate, severe. They might check mild when it's really moderate or moderate when it's really severe, but they'll clue me in. Every new patient, specifically males that I see, and I personally see every male new patient that comes through this practice because I kind of, that's really where I like to be. Not that I don't see females. I physically ask them if they're 30 or older, like, are you having any sexual issues? So then they can lie to me. If they want to lie to me, that's on them. And by the way, if they're lying, it's just because they're not comfortable quite yet. And so typically they'll bring it back up. But I find that most of my guys, and this is what I teach docs that I train with, like, you just have to make the conversation not seem doctory. Make the conversation sound like just two guys talking. Believe it or not, guys talk about this more than people give them credit for. Like I've heard girls say, well, guys don't talk about that kind of stuff. I'm like, actually, they kind of do, especially as you get older. If they're comfortable with somebody, they'll talk because they're like, hey, man, Doc gave me this and it freaking worked, because I can't tell you, I've had many patients come in like, hey, my buddy comes here. He said you did X, Y, Z and it really helped him. Well, if guys don't talk, how did they know? And so I think that stigma of erectile dysfunction has been pretty much taken away with time. I think it's so common these days, and that guys know the stats that, if Jim Bob has some form of, that's a good Texas name, Jim Bob. If Jim Bob has some form of ED, he's not the only guy dealing with it. And then I always, as soon as they tell me they have an issue, I go into my own story really quickly because I think it makes them feel at ease. Well, Doc's dealt with it before, so he understands what I'm talking about. So that's just kind of how we go about it. So.
All right, one more question. Then I really mean we'll wrap it up. So what's the deal with this 4-hour erection? If we see it in all the commercials.
Yeah.
Right? You're sitting there watching TV with your family and it's
You wish. No, I'm just joking. That is one potential side effect. I can be honest, I've never seen it occur. Priapism, I've never actually seen it occur with it. And we do tell our patients, if you do get an unrelenting erection, you're going to have to go to the ER and that sort of thing. But that is like hitting the lottery on Saturday night without buying a lottery ticket. That's just such a rare occurrence. I think that sometimes, now the good news is with erectile drugs, guys doesn't phase them. They're like, I'll take my chances. They're willing to take it. The biggest side effects we see with PD5 inhibitors is typically flushing, because it's actually dilating other blood vessels, so that sometimes headaches, their ears feel red, their face gets a little flushed. The good news is now that we really recommend taking these drugs every single day, typically those side effects go away very, very rapidly. I will tell you that back when I used to take it just as needed, I would have significant side effects. And I would actually always joke I wouldn't want to have sex by the time it fully kicked in because my ears are red, my face is red, I had this pounding headache. Then I started taking it every day, and within 2 to 3 days, no more side effects. Couldn't even tell you that I take it, other than sex is better and I pee better. And I'll take both of those. So no big deal with that. Just something to be aware of.
All right. So guys, if you've been listening, or ladies, you got someone that you want to recommend to come in and see Dr. Kris. How do they get a hold of you, Dr. Kris?
Well, so through the website or the researchclinic.com, or just call us 817-599-9902. Or if you're local, obviously you can just walk in the front door and talk to us. But we're going to want to start with an evaluation, and we typically like to draw labs, and then we like to sit down and go through everything, because we don't want to focus just on one problem. We want to get a global kind of idea of your overall health. And then, because a lot of times just some really simple things can have some profound effects with time. So we like to look at the long game, not the short game, and then address it from there.
All right. Excellent. We're going to roll out the rollout here. Here we go. Thanks for joining the Dr. Kris Podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information, or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris Podcast. All right, Dr. Kris, you have a good weekend. I'm going to end it.
Thank you. You too.